Some women have pre-existing medical conditions when they become pregnant, requiring special prenatal monitoring. To find out more about the care for these high-risk pregnancies, we spoke with perinatologist Dr. Ralph Steiger of Desert Regional Medical Center in Palm Springs.
Maternal-fetal medicine is the study of complicated pregnancies. To lay people, they usually refer to me as a high-risk OB specialist. The most common thing I do as a perinatologist actually is obstetrical ultrasound. Basically, the perinatologist in most communities have become the expert in obstetrical ultrasound. So some people are referred to me because they prefer that I do the screening, but a lot of times it's because an issue has come up where they want an expert to look at the baby on an ultrasound. Either they have an abnormal screen for Down syndrome or neural tube defects, or somebody thinks they have seen something abnormal on the ultrasound. The new machines, especially the ones with 3D imaging, produce unbelievably clear images at times. It's almost as though you can really see them. Not so much just the 3D imaging, but the same probe produces a dramatically improved two-dimensional image. So our ultrasound has improved quite a bit. In addition to that, we have better nursing care in our hospitals and facilities. We have nurses that are focused on the complicated patient and the patient who is admitted before the baby's due. The hospitals oftentimes are much more geared to dealing with obstetrics. Many obstetrical units, as a matter of fact most, now have dedicated operating rooms just for their patients to have cesarean sections. Whereas in days gone by, when you had to do a cesarean section, you then had to compete for space in the operating room, and somebody had to be convinced to give up their time so you could do an emergency procedure. In terms of unnecessary sections, you have to apply it to the individual patient to make a decision whether it's necessary or unnecessary. And there are certainly arguments both ways. One of the most common criticisms of doctors in malpractice suits is they didn't do a C-section or they didn't do a C-section soon enough. And that's a tremendous pressure on the doctor to perform cesarean sections. On the other hand, there are times when you can argue, well, you know, if you just waited a little while longer, the patient would have delivered, or the baby didn't look that bad, you could have waited longer. One of the more unusual things that's happening in the last few years is the patient choice C-section, the patient who requests a cesarean section. And the numbers of those have increased dramatically in the last 3 years. A few things you can do to prevent a complicated pregnancy actually start before pregnancy. Making sure that your health is good. If you have issues with diabetes, you should consult with your doctor to make sure your blood sugars are in good control before you get pregnant. That will help decrease the number of birth defects associated with those pregnancies. Periconceptual folic acid supplementation is also very important in decreasing the rate of neural tube defects. And then just planning the pregnancy in general. Having the pregnancy at a time when you want to be pregnant is a good idea, although unfortunately it doesn't happen a lot. About half of our pregnancies are unplanned, spontaneous.